To begin, we must assess the hands. Nails should be kept short. We have to keep our nails short because natural nails are less likely to harbor microorganisms, scratch a client, or puncture gloves. Then, removal of jewelry is recommended. Microorganisms can lodge in the setting of jewelry and under the rings. So removal facilitates proper cleaning of the hands and arms. Then lastly, we have to check hands for breaks in the skin such as hangnails or cuts. A nurse who has an open source may require a work assignment with decreased risk of transmission and infectious organisms due to the chance of acquiring or passing on an infection. If you are washing your hands where the client can observe you, introduce yourself and explain to the client what you are going to do and why it is necessary. And then we have to, what we're going to do is to turn on the water and adjust the flow. We have to adjust the flow and make sure that it is warm, since warm water removes less of protective oil off the skin than hot water. Then we have to wet the hands thoroughly by holding them under the running water and apply soap to the hands. So we have to hold the hands lower than the elbow so that the water flows from the arms to the fingertips. The water should flow from the least contaminated to the most contaminated area, since the hands are generally considered more contaminated than the lower arms. Then, grab the soap bar and then rub them firmly between the hands. And then, thoroughly wash the hands, and then we have to put your right palm over the left dorsum with the interlaced fingers and vice versa, like this. And then, palm to palm with finger interlaced. And then, the backs of the fingers to opposing palms with fingers interlocked, like this. And then vice versa. And then, rotational rubbing of the left thumb clasped in the right palm and vice versa, like this. So we have to continue these motions for about 30 seconds. So the reasons for the interlacing fingers and palms and the circular action is to create friction that helps remove microorganisms mechanically and to cleanse the interdigital spaces. Now, what we're going to do is to rub the fingertips against the palms of the opposite hand, since the nails and fingertips are commonly missed during hand hygiene. Then afterwards, we have to rinse the hands. Then, thoroughly pat dry the hands and arms with a paper towel without scrubbing, since moist skin becomes chapped readily, as does dry skin that is rubbed vigorously, and the chapping could produce lesions. After patting to dry, we'll have to discard the paper towel in the appropriate container. Then, turn off the water using a new paper towel to grasp a hand-operated control. This prevents the nurse from picking up microorganisms from the faucet handles. Prior to perform the procedure, we have to perform hand hygiene and provide client privacy. Now we're going to open the package of sterile gloves. So this is the only available size that I bought. So we have to place this package on a clean, dry surface because any moisture on the surface could contaminate the gloves. We have to make sure that we don't touch the inside because it's already sterile. So we always have to remember that the outside of the gloves are sterile while the inside of the gloves are not. So first we have to identify which is your dominant and non-dominant hand. So we have to put on our gloves to our dominant hand first. This is my dominant hand. So we have to grasp the cuff with the thumb and first two fingers of the non-dominant hand, touching only the cuff. So here, this is not sterile. So gently pull the gloves over the dominant hand, making sure that the thumb and fingers fit into the proper spaces of the glove. So we have to position our hands just above the wrist line while applying the glove. Keep hands visible and above wrist to prevent accidental contamination. So with our gloved hand, carefully slip fingers under the cuff of the glove. Here the other glove. We have to make sure that it does not touch any part of the non-dominant hand. So here, since this is already sterile, we have to place it here under. So gently slip the glove onto the non-dominant hand, making sure that the fingers slip into the proper spaces. So with the gloved hands, we have to interlock our fingers to fit the gloves onto each other finger. We have to make sure that it fits. Before handling the respirator, we have to wash our hands thoroughly with soap and water. And then, we inspect the respirator for any damages. So if your respirator has been damaged, do not use it, get a new one. So anything that comes between respirator and your face will make the respirator less effective. So do not allow any facial hair, jewelry, glasses, or clothing that come between your face and the respirator on the face. First, place the respirator on your face so that the foam rests on your nose and the bottom panel is securely under your chin. Then, pull the top strap over your head and position it high on the back of your head. Then, pull the bottom strap over your head and position it around your neck and below ears. Then, adjust for a comfortable fit by pulling the top panel toward the bridge of your nose and positioning the bottom panel under your chin. Then, place the fingertips from both hands at the top of your nose and mold the nose piece around your nose to achieve a secure seal. Afterwards, we have to check the seal of your 3-panel face piece respirator each time you don the respirator. So we have to place one or both hands completely over the middle panel. Inhale and exhale sharply. So if air leaks around your nose, readjust the nose piece. If air leaks between the face and face seal of the respirator, reposition it by adjusting the panels and straps. So if you cannot achieve a proper seal, do not enter the contaminated area. Without touching the respirator, slowly lift the bottom strap from around your neck up above your head. Then, lift off the top strap. Do not touch the respirator. Then, store and discard according to facility infection policy. First, we must secure hair with rubber band for those with long hair. Then, spread the headgear using both hands. First, put on both hands covering the hair in the forehead first going to the nape. Then, wound remaining hair and secure inside the headgear. Then, check for any stray hair thoroughly.